It's a massive multi-billion-dollar deal just inked between CVS Health and Aetna, the drugstore giant moving to buy the nation's third largest insurer in a deal that could reshape the health industry as we know it. So here to explain what it means for you, radiologist Dr. Nicole Saphier. Thank you so much for joining us.
Good morning, Heather. Thanks for having me.
So let's take a look at some of the specifics of the deal. It's a $69 billion deal. CVS Health purchasing, that's a purchase price for Aetna. And this may not necessarily be a good thing for consumers.
Correct. I mean, a lot of people have a lot of different opinions when it comes to this merger. Essentially, what you have is one of the largest pharmacies merging with the largest insurance network, and you have two giants coming together and just making a very large monopoly.
Right.
So people have some concerns about it, and I think we've put together some great true-false questions as to if we think that they're good or not.
So the first question would be, will it improve access to quality care?
So, and this is the biggest concern I have, because convenience is not synonymous with good quality care. What I envision is going to happen, and by the way, they haven't come out with all the details, so we don't know exactly what's going to happen, but what I foresee happening is CVS already has these minute clinics instituted within the pharmacies, your neighborhood pharmacy, where you can go and get a flu shot.
Yes, flu shot. I've done that.
And these are employed with nurses and physician's assistants. There are no physicians there. If this is going to be your new stop for your primary care, are we cutting out physicians altogether? Are these patients going to be restricted to only seeing nurses and physician's assistants and have to pay a premium to actually go see a doctor if they want to? So
then that brings us to the cost question, and would there be less out-of-pocket cost for patients?
I have to say false. Retail clinics and pharmacies, really we don't see the cost savings at the patient level. Yes, there will be some savings with price negotiations between the drug companies and the pharmacy. However, will the patient actually see the cost? No, not historically.
Yeah, and you've been here before. We talked about the opioid crisis at length. A lot needs to be done in that area. Do you think that this merger will help at all?
Interestingly, although I have strong reservations about this merger, this is one area that it may actually improve with the opioid crisis. It's not going to fix it, but it's going to help it a little bit in the sense that right now you have patients who are able to get multiple opioid prescriptions from various doctors, and there's very little oversight. We're working on being able to monitor these patients to make sure they're taking them effectively. If you have one insurer and one pharmacy, they're going to be well aware how many opiates this patient's taking, so they are going to have some more control, some more monitoring. I wish we could adopt that nationally, not just at one big monopoly setting.
Right. So in that respect, it would be good to have just one pharmacy that you're dealing with, but would I have to deal with just one pharmacy? Will I be limited in what pharmacy I use?
Absolutely, yes, you will, and that is a big concern that I have. Is we're already complaining we have narrow networks under the Affordable Care Act. Can you imagine how narrow the network's going to be if you have one insurer, one pharmacy? That insurer is going to say you have to go here, and that's it, and you'll probably have to go pay a premium if you want to go to the other drugstore down the street.
Yeah, less choice, higher cost.
Exactly.
We've seen that happen before, and it will probably happen here too. But we'll see, right?
We will see.
Okay. Thank you, Dr. Saphier. Appreciate you joining us.
Thanks for having me.